An instructional video on guidelines for primary healthcare workers on providing services during COVID-19 outbreak. As a primary healthcare worker, you are the closest healthcare provider to members of your community. You must take the necessary actions to protect yourself, your family, your clients, and your co-workers from COVID-19. Before clients arrive, take the following steps to protect yourself, your family, your clients, and your co-workers from COVID-19. Know about COVID-19. Be familiar with contents of IEC materials from credible sources such as NCDC, NPHCDA, and WHO. Know the COVID-19 helpline numbers, including alternative numbers for your state. Wear PPEs like face masks and gloves before commencing sessions. Maintain at least 6 feet or 2 meters distance during consultations, except when examining a client. Display IEC materials about preventive measures at entrances and in waiting areas. Provide hand washing points with running water and soap or hand sanitizers where there is no water available. Provide dustbins for waste disposal. Ensure rooms are well ventilated. Ensure sitting arrangements for clients is 6 feet apart. Identify a room or area where all suspected COVID-19 cases would be isolated before an ambulance arrives. When clients arrive, screen all clients for COVID-19 according to the guidelines for case identification and triage for COVID-19 and refer all suspected cases accordingly. For clients that are not COVID-19 suspected cases, ensure every client wears a mask. Do not have more than 10 clients in the waiting area. Ensure clients are seated at least 6 feet apart. Give health talks on COVID-19 and other related health conditions while clients are waiting. Render services as soon as possible. Do not wait for clients to gather. Phase appointments to reduce the contact time between you and the clients and between clients. For provision of antenatal care services, admit clients into consulting rooms and rescreen for COVID-19. If a client is suspected for COVID-19, call the state COVID-19 helpline and isolate immediately. Provide antenatal care services as appropriate for non-COVID-19 suspected cases. For provision of safe delivery and postnatal care, immediately refer any woman in labor that has signs of COVID-19. Isolate and observe the necessary precautionary measures while waiting for transportation. Conduct every delivery wearing PPEs, including aprons. After each delivery, properly dispose of non-reusable supplies and decontaminate non-disposable instruments such as ambu bags, masks, suction devices, and the labor ward after each delivery. Do not make unprotected contact with a newborn whose mother is a suspected case of COVID-19. Provide postnatal care checks within 48 hours of delivery to mother and child at the healthcare facility or through a home visit. Refer any woman or newborn identified with symptoms of COVID-19 during postnatal care checks. For community management of acute malnutrition, CMAM, treatment of childhood illnesses and immunization services. CMAM clinics should remain open. Book appointments and track clients through SMS. Monitor children at outpatient clinics. Increase clinic hours to avoid overcrowding. All routine immunization RI services must continue uninterrupted, while individual counseling should replace group demonstration. Limit outreach activities, targeting only hard-to-reach settlements. After clients leave, clean all surfaces like desks, door handles, tables and chairs in the waiting and consulting rooms using disinfectants. 50 milliliters of bleaching agents to 4 liters of water. Sterilize all instruments. Properly dispose of wastes. Wash hands thoroughly using running water and soap. Change all protective gear. Prepare for the next clinic sessions. Request for replenishment of supplies. This instructional video is brought to you by the National Primary Healthcare Development Agency, NPHCDA, in collaboration with the Federal Ministry of Health and Development partners.